Hi, I'm Emma Vestesson, and I'm sharing our work on the use of remote consultations in primary care in England before and during the COVID-19 pandemic. So over 98% of the population is registered with primary care, so most of us will interact with primary care at some point during our lives. It's also often the way you access specialist care. Now, we know that primary care workload has increased in recent years. We also know that COVID caused a large shift in the way that primary care is delivered, with more remote consultations taking place. The topic of remote versus face-to-face consultations has become a hotly debated area, with broad statements such as all consultations should be remote by default being made. Because of this, we want to describe the use of remote consultations during the pandemic and compare that to before the pandemic. Now, we use clinical data from CPID Aurum, which is data that's been extracted from the EMIS system, and it's broadly representative of the English primary care population. We extracted data for 600,000 patients from 400 practices in England, covering the time period of January 2018 to November 2021. We then grouped all consultations into clinical, admin or other, and this was done based on the staff member and the consultation time that was recorded by the person carrying out the consultation. And then for clinical consultations, we further grouped them into remote versus face-to-face, again using the type that was recorded by the person carrying out the consultation, as well as any information actually recorded during the consultation. Finally, we calculated the consultation rates per patient year registered, and we did this by age, sex and patient level deprivation as well as overall. Top chart on the left-hand side, before the pandemic, remote consultations accounted for approximately 20 to 25% of all consultations. And when the pandemic started, there was a sharp increase in the use of remote consultations. You can see that it peaked in April 2020. Now, despite subsequent waves of high COVID infection rates, remote consultations never made up such a high proportion of all consultations as they did at the beginning of the pandemic. When we look at the data in a slightly less granular way, so year by year, as you can see in the table, we can see that between 2018 and 2021, face-to-face consultations decreased by 50%, whereas remote consultations increased by 160%. Finally, looking at the remote consultation rates in the right-hand chart, so this is the blue line, we can see that after the initial increase at the beginning of the pandemic, remote consultations remained fairly stable, whereas face-to-face consultations fluctuated a bit more. You can also see that overall, at the end of our study period, the overall consultation rates were similar to pre-pandemic rates. This is a dashed line. So the bar chart that you can see on the left-hand side, we found that there was no substantial difference between men and women when looking at the proportion of remote consultations. However, in the oldest age group, women had a higher proportion of remote consultation than men in all years. We then looked a bit more in detail by age, and we found that even though all age groups saw an increase in the use of remote consultations, there were some differences between the different age groups. These can mainly be grouped into the youngest age group and the older age groups, so starting from 45 years. These groups had more face-to-face than remote consultations by the end of the period, and they also saw quite a strong peak in face-to-face consultations in the autumn of 2020. So finally, we looked at the proportion of remote consultations by patient level deprivation. And we found that pre-pandemic, the proportion of remote consultations was lower in the most deprived group compared to the least deprived group across most age groups. However, this was reversed during the pandemic. So, for example, for 55 to 64-year-olds, the proportion of remote consultations for the most versus least deprived in 2018 was 17 compared to 19%. But in 2021, the same numbers were 53% and 51%. So to summarise, we analysed trends across patient age, sex and deprivation using a dataset that covered over 1 million patient years of observation. We found that the rate of face-to-face consultations decreased by 50%, whilst the rate of remote consultations more than doubled. This meant that there was an overall decrease in the proportion of consultations being delivered face-to-face from 81.3% in 2018 to 47.8% in 2021. We think that the variation in the proportion of face-to-face consultations by age suggests that there is prioritisation of groups by need happening in primary care. I think it's important to understand the reasons behind the reversal of the relationship between deprivation and the proportion of remote consultations. Thank you for listening.